I've been waking up slow with the weight in my chest, like the sun forgot how to shine in the west. And I smile when they ask, say I'm doing just fine, but there's thunder rolling quiet in the back of my mind. Some days are light, and some days I fake, and some days I break for my own damn sake. Well, the thing is, I'm trying, even when the voice in my head keeps lying. It's a war just to get out of bed, but I breathe in deep and I face it instead. No, I'm not alright, but I'm fighting to be. Well, the thing is, I'm still me. I got friends who don't call, and I don't blame them. Hard to hold space when your world's gone vacant. And I wish I could tell you what's missing inside, but it's foggy in here, even with open eyes. I wear my silence like armor, I know, but there's hope in the cracks where the light starts to show. Well, the thing is, I'm healing, even when I don't trust what I'm feeling. Every scar is a line in my song, every stumble's a sign. I've been walking this long, and I don't have the map, but I've got my feet. Well, the thing is, I'm still me. I won't lie and say it's easy, but I won't hide the storm inside. If you're walking through the darkness, take my hand, we'll walk side by side. Well, the thing is, we're learning, and the fire in our hearts keeps burning. Even when the night feels too long, the strength in the fact we go on. So if you're not okay, let this song set you free. 'Cause the thing is, you're still you, and that's still enough for me.
What is going on, everybody? Can you hear me loud and clear? I hope you can. So today's live is about cyclothymia, okay? I'm going to bring a screen up so we can talk about it. So what is cyclothymia? Also called cyclothymic disorder, a rare mood disorder. Cyclothymia causes emotional ups and downs, but they're not as extreme as those in bipolar 1 and 2 disorder. And Willow, how you doing? Danny Lioness, how you doing? Regina, how you doing? Those of you lurking in the background, how you doing? Hope you're doing well. I'm back to it. So with cyclothymia, you experience periods when your mood noticeably shifts up and down from your baseline. You may feel on top of the world for a time, followed by a low period when you feel somewhat down. Between these cyclothymic highs and lows, you may feel stable and fine. Although the highs and lows of cyclothymia are less extreme than those of bipolar disorder, and it is critical to seek help managing these symptoms because they can interfere with your ability to function and increase your risk of bipolar 1 or 2 disorder. Treatment options. Well, we're not going to therapy, medication, and ongoing follow-up with your doctor. But that's not what we're talking about, the therapy and all that. We're going to talk about the symptoms. Okay? Vibrant, how you doing? So, symptoms of cyclothymia. Alternate between emotional highs and lows. The highs of cyclothymia include symptoms of elevated mood, which is a hypomaniac symptom. The lows consist of mild or moderate depressive symptoms. They're familiar of those of bipolar 1 or 2 disorder. They're less severe. When you have cyclothymia, you can typically function in your daily life, though not always well. The unpredictable nature of your mood shifts may significantly disrupt your life because you never know how you feel. You never know how you're going to feel. You just don't know. That's the intriguing part. You don't know what's going on because it's a mood swing and you have no control over it. That's why therapy, I promote therapy. I tell you guys, and I don't just say settle for the first therapist you come across. Do your homework. Okay? When it comes to therapy, do your homework. Please. Find somebody that you can connect with. And they understand you for you. Not somebody who's just there to collect a check. Okay? So, signs and symptoms of the highs of cyclothymia may include an exaggerated feeling of happiness and well-being, euphoria, extreme optimism, inflated self-esteem, talking more than usual, poor judgment that can result in risky behavior or unwise choices, racing thoughts, irritable or agitated behavior, excessive physical activity, increased drive to perform and achieve goals, sexual, work-related, or social, decreased need for sleep, which is unhealthy, tendency to be easily distracted, inability to concentrate. Vic Ferrari, how you doing? Now, these are the hypomaniac symptoms, manic symptoms, hypomanic symptoms. Okay? Now, the depressive symptoms, and we know what those are normally: feeling sad, hopeless, or empty, tearfulness, irritability, especially in children and teenagers, loss of interest in activities once considered enjoyable, changes in weight, feelings of worthlessness or guilt, sleep problems, restlessness, fatigue or feeling slowed down, problems concentrating, thinking about, and you can see this because I'm not going to say it because, but self-harm, thinking of that, So now to understand these symptoms, if you have any of these symptoms of cyclothymia, seek medical help as soon as possible. Please. Okay? Don't wait till it's too late. When you feel these moods coming on, seek help. Talk to somebody. Work through it. Be open. Because generally, it doesn't get any better on its own. If you're reluctant to seek treatment, work up the courage to confide in someone who can help you take the first step. A friend, a significant other, somebody you have faith in you can trust. If a loved one has symptoms of cyclothymia, talk openly and honestly with that person about your concerns. You can't force someone to seek professional help, but you can offer support and help find a qualified doctor or mental health provider. Self-harm thoughts. Although self-harm thoughts might occur with cyclothymia, they're more likely to occur if you have bipolar 1 or 2 disorder. If you're considering it right now, call the emergency number, 911, 911. or your local emergency services number, or go to the hospital emergency room department. Call 988 or use Lifeline Chat. They're free and confidential. Don't be afraid to reach out. Okay? Don't be afraid to reach out. Now, what causes cyclothymia? Genetics. It tends to run in the family. Differences in the way your brain works, such as changes in the brain's neurobiology, environmental issues, such as traumatic experiences and prolonged periods of stress. Risk factors. Cyclothymia is thought to be relatively rare, but true estimates are hard to make because people may be undiagnosed or misdiagnosed as having other mood disorders such as depression. Cyclothymia typically starts during the teenage years or young adulthood. It affects about the same number of males and females. Complications. If you have cyclothymia, not treating it can result in significant emotional problems that may affect every area of your life. There's a high risk of later developing bipolar 1 or 2 disorder. Substance misuse is common. You may also have anxiety disorder. You may be increased risk of self-harm thoughts or self-deletion. Prevention. There's no way to prevent cyclothymia. However, treatment at the earliest indication of mental health disorder can help prevent it from worsening. Long-term prevention treatment can also help prevent minor symptoms from becoming full-blown episodes of hypomania, mania, or major depression. With that being said, I'm going to drop the link. And Hubert, quit barking. And if you want to come up on panel, you're more than welcome to join me on panel. I hope everybody's well. I had a good day today. I had therapy today. So don't be afraid to click the link. Come join yours truly on panel. Tell me about your day. What's going on? How you feel? Or say it in chat. Let me know how you're doing. Let me know how well you're doing, how things are. Fill me in. Come here. Come here. Come here. Lay down. Stay. Good boy. Got a dog. His name's Hubert. He's an older dog. And every movement and piece of noise, he barks at it. Not loud, because he's not aggressive. So relax. Okay? You're good, buddy. So, all right, Viper. I hope that goes well, bro. It's good seeing you in chat. So, I got to talk to you about the podcast. So, when you're free, let me know what your schedule's like, because I got some interesting information. So, I've been what was I gonna say? Bring Regina up on stage. What's going on, Regina?
Hey, Eddie. So this is actually pretty fascinating. I have a lot of questions about the topic of hand, the cyclothymia.
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 Yes.
So now there are so many different characteristics of it that I guess are the same symptoms that are often dealt with in bipolar. What's
Yes.
the difference between the two?
Okay. Um, you so cyclothymia or cyclothymic disorder
Hmm.
is a chronic mood disorder. Now, it's less extreme mood swings than bipolar disorder, okay, involving reoccurring episodes of hypomanic symptoms, mildly elevated mood and energy, or mild depressive symptoms. So they're not major, okay, like bipolar would be. Like, so you have hypomanic, like hypo. So let me pull up what bipolar 1 is and bipolar 2 is, and then we'll compare all three.
Awesome.
Okay, so versus bipolar 1 and 2. Okay, so bipolar 1 involves severe manic episodes lasting at least 1 week, which can be severe enough to require hospitalization and often includes depressive episodes. Bipolar 2 requires at least one hypomanic episode, less severe than mania, and one major depressive episode, with depressive episodes being being a major feature. Okay. Cyclothymic disorder is mild. It's a chronic condition with frequent shorter duration. So it doesn't last as long, if that makes sense.
It does. So does that mean that the I hope I'm pronouncing it right. This
Yes,
is a new word for me.
cyclothymia. Yes.
Okay. The cyclothymia is like would because I see that in some instances people are later on diagnosed with bipolar 1 and bipolar 2. Is that because it can progress into it, or is that
If it's
the
untreated.
okay. So this is something that leads up to bipolar 1 and 2 if untreated typically.
Yes.
Okay, that makes sense. Thank you. Thank you for answering that. I was so confused because I didn't know if that meant that like is would it be, a reoccurring theme that people were misdiagnosed with cyclothymia um versus bipolar, but I see that it is literally leading up to a bipolar diagnosis
Yeah, because
eventually.
cyclothymia is a mild form of bipolar disorder. It's a
That
mild
makes
form.
perfect sense.
Okay.
Thank you. Yes.
So basically, cyclothymia is also known as bipolar disorder type 3. Okay. So it's the mellow version of BP, BPD 1 and 2.
Right. And it seems
So,
like it can in fact progress into,
yes,
having yeah, wow. Wow.
if it goes untreated, like anything. If
Yeah,
anything can go untreated, it gets worse over time.
exactly. Yeah. Yeah. Wow, that's fascinating. Hmm. I wonder how they do, differentiate, with a diagnosis, especially because, bipolar and, the cyclothymia and, bipolar 2, they would all be clinical diagnosis, set on a set of behaviors from a person, right?
It's all in how the person acts.
Right, right.
You,
Yeah.
you can tell just by talking to the person and asking certain questions how they answer them.
Yeah. So, like bipolar, would cyclothymia, would it be treated with medications and therapy?
It can be, yes.
Oh, okay.
But not
Is
always is medication required.
right. That's what I
Sometimes,
started to ask. Is
yeah,
it also
sometimes
one of
it's,
those things that therapy can, relieve a lot of the
yes.
symptoms? I love that. That's good hope. That means that, anyone out there that's, having emotions that they don't understand and stuff, it's always so important to seek guidance and counseling because it can actually be preventative in long-term mental health issues. That's
So,
a very good,
I was going to go to the National Library of Medicine and talk about it from there, but there's so many there's they're more scientific with their wording. Okay,
mhm.
so just say I'll read a paragraph. Okay, and I'm like, I'm not gonna sit there because some of these words people would not understand, right? So cyclothymia is a primary mood disorder that is I can't even pronounce the word. I pronounced it earlier. Oh my God. Connotated with great ambiguity and controversy. The primacy of the disorder is inherently nebulous as it shares diagnostic features with a multiplicity of disorders. Cyclothymia is characterized by episodes consisting of hypomanic and depressive symptoms that do not meet the full criteria for bipolar or major depressive disorder. Furthermore, its manifestations onset early in life, uh, demonstrable via temperamental mood reactivity and dysregulation. The complexity of the disorder makes it difficult to identify in clinical practice. So in DSM 5, it is subsumed under the category of bipolar mood disorders. So cyclothymia is somewhat analogous to personality disorders as its onset is early and its course to chronic and persuasive. In fact, cyclothymia is often misconstrued with cluster B personality disorders because of the overlapping diagnostic criteria. It can be easily misdiagnosed, as with psychiatric disorders. It leads to dysfunction and distress. While many psychiatric disorders may participate in the setting of cyclomic disorders, the reciprocal is not valid. For example, although often comorbid with substance use disorders, by definition, cyclothymia is not induced by substance use. Does any of that make sense?
That absolutely makes sense. That absolutely makes sense. Um, there are so many I mean, that to me, that makes perfect sense. I mean,
So I'll
um
finish. I'll finish out the rest. Okay.
okay, okay.
So, although unequivocal in nature, a detailed and careful evaluation can enable clinicians to uncover this sometimes subtle disorder. In event, clinicians find themselves pulled in varied directions regarding the correct diagnosis of an emotional deregulated patient. Consideration of cyclothymia should be paramount. Um, in addition to emotional deregulation, dysregulation, identification of oscillating levels of psychomotor activity, hypersensitivity, hyperreactivity, and interpersonal dysfunction should hint towards a diagnosis of cyclothymia. This article will shed light on this misunderstood and often misdiagnosed disorder? Yes.
That answered all my questions about it being often misdiagnosed for bipolar and, bipolar 2 and other disorders. Um, and that's amazing too, because, with it being so treatable, it can be prevented from going into, having blown bipolar and bipolar 2. That's very interesting.
So
Wow,
right
Eddie.
here, let's go to treatment and management. Okay. Let's talk about the treatment. Okay. So the treatment of cyclothymia rests upon managing risk factors, recognizing early symptoms, and implementing appropriate interventions, including psychoeducation, pharma, um, pharmacotherapy, and counseling. The primary target of affirmation therapies should be focused on the persuasive underlying effective dysregulation. Psychoeducation is paramount and emphasizes the necessity of medication compliance. Confidence in the doctor, acknowledging the interpersonal consequences of the maladaptive behavior patterns, and acceptance of the illness. To date, there are no approved FDA recommended psychotropic medications for treatment of cyclothymic disorder. In spite of this, they remain viable alternatives in the management of disorder. First line psychotropic treatment of cyclothymia is the administration of a mood stabilizer. Valproate, valproate if anxiety is dominant. Lamotrigine if the anxious depressive polarity is more prominent. Lithium for significant effective intensity. Some patients may benefit from dual therapy, both lithium and lamotrigine. Furthermore, a typical antipsychotic can be applied as monotherapy or an adjunctant in conjunction with mood stabilizer. Current research recommends withholding the use of antidepressants in the setting of cyclothymia, as it can exacerbate symptomology. In addition, pharmacotherapy and psychoeducation, cognitive CBT, cognitive behavioral therapy, has shown the most robust evidence of psychotherapies in the setting of cyclothymia. Moreover, treatment plans should be modified ad hoc and not on some premeditated algorithm, predetermined algorithm. So basically, what they're saying is, I take lamotrigine, and it works for me because it's a mood stabilizer.
But antidepressants can exacerbate
Correct.
the symptoms of it. So diagnosis and proper diagnosis is so important.
Yes.
It's so important because if you give someone antidepressants that is suffering, from cyclothymia, it could cause them to have more problems, literally.
Yeah.
Like,
Yes.
yeah.
Yes.
Oh my goodness.
That's
Wow,
why,
this is fascinating.
So when I started reading it, I'm like, are people, because I understand a lot of these words, but now, but there's a lot of people out there not going to understand some of yes, proper diagnosis is critical. Yes. Dandelion S78. Yes. Now, they say the suspected etiologies of bipolar disorder include genetic susceptibility, neurotransmitter dysregulation, and environmental triggers. Cyclothymia is thought to belong to this family of affective disorders, and its etiology is regarded in kind. Now, what is etiology? Let's break that down, because I do not know what that word is. So, we're going to learn etiology, okay, the cause, set of causes, and manner of causation of a disease or a condition. That's what that is. Okay. So genetic factors have robustly implicated the cause or the manner of cyclothymia. This influence is demonstrable by the concordance rate, 57% seen in homogenized twins, homogenized in twins. Current genotypic studies are investigating several loci, including, see, this is where it gets tricky. That's the reason why I went to the Mayo Clinic and they just broke it down a lot simpler for me to read and understand. You know what I'm saying, Regina?
I do. I do.
Because they use, I don't have the book in front of me, so I can't go to 18, P11, 13, Q32,
Right.
clock, genes,
Right.
and I don't know those.
We don't have the footnotes. We don't have the
Correct.
pages.
Like if I had the footnotes and the pages and everything, like I could source like all the information on who it was written by. You know, all you got to do is type in cyclothymia and go to NIH, the National Center for Biotechnology Information, or the National Library of Medicine. You know, I research it before I talk about it. So, but so this is something you learned new today, Regina? She's muted. Hope she knows she's muted. So I'm going to start sharing with you guys once a week, or once every 2 weeks, or when I go to therapy, what I learned in therapy and the packets I bring home and what I got to do for homework. I'm going to share with you guys. In my opinion, I'm going to do that because, you know, that's what I want to do. Regina disappeared. But this was my live. Let's talk cyclothymia. I will see you guys tomorrow, 5:30 p.m. Eastern Standard Time, on another discussion. Don't know what, but you'll see then. With that being said, well, the thing is out, my friends. And thank you, Dandy, for being here. Viprin, all of you that are in chat, those in the bushes not commenting, have a blessed evening, and I will see you guys then. Oh, that's amazing, Dandy. First time I'm hearing about this diagnosis and its effects. So I want to thank you guys for being here. Rock on, rock out. Later, everybody.